Hey everyone, what's going on? My name's James and just want to do another video on my experiences with laser eye surgery and basically everything I've had to deal with and kind of go through since the surgery. If you haven't looked at my earlier video, I did one pretty much about all the complications that I've been experiencing since the surgery. So I'll put a link down in the bottom so for the video if you want to check it out. Pretty much just kind of illustrates all the complications that I've developed since having the surgery about 2 years ago since this date. Basically, I guess my main motivation for making this video is just to kind of warn people about the potential dangers of refractive eye surgery. I mean, most people, when they hear laser eye surgery, they don't really think of it as being something like super dangerous, a super risky procedure. It's obviously marketed as something that's fairly safe, and you don't usually hear about any of the disastrous, potentially life-altering effects from it. You only hear good stories about people that, oh wow, I don't have to wear glasses or contacts or deal with any of that. And to be honest, that's all I had heard prior to getting it, so I wasn't very worried about getting it because I had spoke with a few people that had LASIK or PRK or any of the other number of refractive eye surgeries out there, and they all had great results and were happy with it, so I didn't really think twice about getting it myself or doing any further research into what possibly could go wrong. And unfortunately, that was, not the best thing, but as they say, hindsight is 20/20. Unfortunately, I had to learn the hard way, and this has been a very hard lesson for me. I can say that pretty much like everybody, I have my share of regrets, things I've done in the past that I wish I didn't do, things that I wish I had done differently, and even with all those regrets and everything, getting laser eye surgery has definitely been the biggest regret of my life, and that's saying a lot considering, like I said, I've had a lot of regrets and things, but there's nothing that I regret more than getting laser eye surgery because it has left me disabled. It's ruined my life, and there's nothing that can be done to undo the damage it's done. It's a tough pill to swallow, especially when you're pretty much reminded 24/7 of the mistake you made, because you're pretty much always having to use your eyesight, unless you're sleeping, and it's just very unfortunate that this is something that could have been avoided if my surgeon had actually warned me that I was a very high risk candidate and that I had a lot of things going for me that made this procedure very risky, and that I was not a suitable candidate and should have never gotten it. And regardless if you're a high risk candidate like I was or not, anybody can have complications, even if you're the so-called textbook perfect candidate for this. There's still a risk involved, and you have to ask yourself if you're willing to roll the dice and potentially have one of these life-altering complications, and God forbid you have a similar situation to me where you have multiple complications that makes doing everyday activities and tasks sometimes nearly impossible. What makes a person higher risk for complications? First one is being very, very nearsighted, which I was. So basically, being nearsighted means that you can see up close, but you can't see far away. I had very high prescription prior to getting the surgery. I believe I was a negative 6.5 to negative 7 around there in my right eye, and my left eye was a negative 8. So that's a pretty high prescription. So the higher the myopia or nearsightedness that you have, the more of the cornea they have to take off, and Obviously, the more cornea that they remove, the greater the risk of complications. So that was the first thing I had going for me that made me a bad candidate. Second is pupil size. I have very large pupils, and the larger the pupil, the greater the risk of having certain complications. Mainly complications at night that have to do with lights, like seeing halos, starbursts, getting glare from, car headlights, street signs, or anything like that. And that is due to the size of the pupil in dim light being greater diameter than the ablation zone, which is the zone where they remove the cornea, and that will cause those types of visual distortions. So basically, the size of my pupil in dimly lit conditions was measured at, I believe, over 7 millimeters, but the ablation zone was only 6 millimeters. So who knows why they decided to do that when obviously that would cause issues. But like I said, these are things that unfortunately I didn't know until after the surgery. I guess the third thing that made me a high risk candidate was I had thin corneas to begin with. Obviously, they're extremely thin now that a lot of it's been removed, but prior to the surgery, I had thinner corneas, so that put me at greater risk. And my surgeon had told me that I wasn't even a candidate for LASIK because they were so thin, but he could potentially do PRK, which, when he was very hesitant about doing it at first, and obviously looking back at that, I should have seen that as a red flag. I mean, seriously, it's like when he was that hesitant, he was like, oh, I don't know, maybe this other surgeon I know, will be better at doing it. And then eventually he was just like, well, I'm going to do it anyway. And foolishly, I was just like, all right, well, went ahead with it, which, was stupid, but, it is what it is. So thin corneas are definitely will put you at higher risk. A fourth thing that made me a high risk candidate was I have a autoimmune condition, and if you have autoimmune conditions like issues like I have ulcerative colitis and a couple other autoimmune conditions that can actually affect the healing of the eye after the surgery, and it can cause it to really not heal well. So I'm not sure if that had anything to do with me having any of the complications I have now, but that probably didn't help. So yeah, another thing I wish my surgeon told me, but didn't. So yeah, that sucks. And then there's also other things that will put you at higher risk, but those are, I'd say, the main four ones to definitely be aware of. Also, if you have dry eye, which I had slight dry eye prior to that, but if you have any type of dry eye before surgery, that's going to put you at greater risk, especially for having severe dry eye after the surgery, which is one of the first complications I developed. Yeah, if you have any type of dryness with your eyes prior to surgery, I almost 100% guarantee it's going to be 10 times worse after the surgery. So that's something else to keep in mind. So a little bit of history as far as how my vision was prior to the surgery. I had been pretty nearsighted at a very young age. By third grade, I was wearing glasses, and by junior high, I ended up getting soft contact lenses because I hated wearing glasses. I just hated the way they made me look, and I didn't like not having the peripheral vision, and also I played a lot of sports, so glasses were just not conducive for that, especially contact sports. So I'd switched to soft contact lenses, and honestly never really had many issues with them. I mean, putting them in, taking them out, that became second nature. I guess the only things I really didn't like about it was sometimes they would fall out either swimming or if I was doing, if I was boxing or grappling or whatever, and somebody would, hit me in the eye with a punch or elbow or rub against my eye or whatever, they'd fall out, and that was kind of annoying. And also, over the last few years, I had noticed that they had started to get drier, or my eyes had started to get drier, and I felt like they were kind of rejecting the contacts. So that was kind of another reason why I decided that I wanted to get laser eye surgery, was just because the contacts they weren't really bothering me a whole lot, but there were times when they would bother me enough where I would just keep scratching my eye, and I just kept rubbing it, and that led me to get a few corneal abrasions, which are no fun. I mean, you have to take special steroid drops in your eyes, and you can't wear contacts for a while and just wear glasses, which, now looking back at it, I mean, that was nothing compared to what stuff I have to do now every day. Contacts, they weren't that great, but honestly, I mean, they were easy to deal with. I just didn't like the fact that I had to rely on them. And another part of the reason that I wanted to get the surgery was I just felt like it would increase my independence. It's like my vision was so bad. It's like if I didn't have my contacts in, it's like I might as well have been in Africa or something, because I could not see anything. It's like I would have been lost. And my fear was always like, what happens if I lose my contacts or I don't have my glasses around? It's just like I'm just gonna not be able to see anything. And I just felt like if I could get my vision corrected and didn't have to rely on any type of corrective lenses, then I'd just be a more independent person. And it's kind of funny because now I'm less independent than I ever was when I had glasses or contacts. So unfortunately, the opposite outcome came out, but after having the surgery. But then again, it was just something I would have never ever in a million years had thought. So I guess my experiences after the surgery, I'll go over that a little bit. Initially, the surgery was, the results were great. I had the PRK, so it takes a little bit longer to heal than the LASIK. They say LASIK, after a day or two, I mean, you can basically you're healed, where PRK, the healing process takes about a week or two, which I knew that going into it. So for about a week and a half, I couldn't work. I had to wear these special goggles and everything, and my vision was pretty distorted, but after about 2 weeks or so, it cleared up, and for maybe about 4 or 5 months after, my vision was perfect. I was super happy with the results. I was just like, wow, this is great. I'm so happy I did this and everything. And actually the vision was good, I'd say, until about 8 months after the surgery. But it was about 4 months after the surgery where I started to experience my first complication, which was the severe dry eye. So basically, I started waking up at night where my eyes were just in so much pain, and I was so just naive and not educated about any of these complications that for the first month or two, I had no idea that this had anything to do with the surgery. I was just like, okay, I'm experiencing some weird eye pain, and I have no idea why. And then after a couple months, I realized that it was due to the surgery when I started doing research on complications and found out that the most common complication is dry eye. So that took a while to kind of figure out, but honestly, having dry eye sucks, but and waking up, having to put drops in when you wake up because your eyelids are stuck to your eyes is no fun. But if that's the only issue you have from the surgery, I mean, who cares, because your vision's still fine. That was basically the first complication I got. And then I'd say about 8 or 9 months after the surgery was when I started to experience some of the visual issues. First issue I noticed was basically just driving at night, where car headlights, traffic lights, stuff like that started to give me the starburst effect, halos around lights and stuff, but it was very minimal, so I wasn't too worried about it. And that was pretty much the only thing that I really had going on. And I didn't even realize that I had to do with the surgery at the time, and it just took me a little while to figure out that, because that's also like another common complication is having those distortions of lights at night. So that took me a little while to figure that out, but it really wasn't bad. But as time went on, those distortions became greater, and they got to the point where I started having those distortions during the daytime with lights. I started experiencing excessive glare, where everybody experiences glare to some extent, but I was just getting massive amounts of glare where if somebody was next to a window, especially if it was bright outside, I wouldn't even be able to recognize their face. Like, that's how bad the glare was. So I had that. I started to lose my night vision, where I just could not see anything in the dark. There was very little contrast sensitivity to objects. So, I use an example in my other video. It's losing contrast sensitivity. It's like basically if you're looking at like a field of grass, normally, you'll kind of be able to see the blades of grass and everything. It's just for me, it just looks like a green, I don't know, blob. It's like you don't see the details. And if like looking at a piece of wood, you don't see like the grain in the wood or anything. It's just everything is all kind of blurred and just blended together, and it's just weird looking, and yeah, it sucks. And I also noticed just my visual acuity starting to go and just not being able to read things. My close-up vision started going where I could not really read or write. I mean, I can sort of read and write, but it's very hard, and it puts a lot of strain in my eyes. Reading, looking at a screen for more than a few minutes, it just gives me a massive headache. I guess the next complication I started experiencing was a massive amount of floaters, just squiggly lines, black dots, everything just all over my visual field. And fortunately, this is something that I don't normally notice too much unless I'm looking at monotone background. Like, for instance, I went snowboarding the other week, and just looking at the snow, just white background, you just notice so much. It's just very distracting. And floaters, I guess, is something that a lot more people can relate to, because a lot of people have floaters who don't have the surgery, but the surgery is linked to causing floaters. I had never ever experienced a floater in my life prior to this, and now my visual field is just plagued with them, and it's very annoying. Not the worst complication I have, but it's just all these things just build up, and it just makes it so it's horrible trying to like see anything. I guess kind of a more rare complication I started to experience is, the layman's term is like visual snow. So it's basically everything has a snowy, staticky effect to it. So it's like looking at one of the old televisions where the screen is just all staticky and flickery and stuff like that. That's kind of what everything looks like to me. And it's more noticeable in darker environments, and also like with the floaters, if I'm looking at a more monotone background versus something like varied scenery with a lot of different objects or whatever, it's less noticeable. But darker environments, just looking at like one plain color, it's super noticeable, and it's super annoying, and it's just it really freaked me out the first time I saw it. I mean, I'm starting to get used to it now, but I don't feel like you ever really get used to any of these things. That is not a fun complication. And then one of the last complications I developed, probably the worst one, is I call it visual trailing. I think some people call it ghosting, but I'm not sure if ghosting is actually the same thing. But it's basically where you see kind of like multiple images of something moving, so just like still after images of something. So if I'm moving my hand like that, basically instead of just like seeing the hand moving, It's like you see, it's just like bump, 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 bump. Just it's hard to describe, but you see like all these like still images of it that last for like a second or two, and it's like an acid trip. It's like if you've ever taken a hallucinogen and you start seeing things moving and these weird trail effects, it's pretty much almost exactly like that. That's like one of the hardest things I've to deal with, and lots of times that's due to a neurological cause. So I'm going to actually see this doctor sometime the end of next month, and just to make sure that I don't have any neurological issues going on that may be causing it. I mean, I assuming this is due to the surgery directly related to it, but there could be something else at hand possibly contributing to it. So I just want to make sure that it's not due to something else. So I'd say those are basically the main complications. It sucks having to deal with even just one or two, but honestly, it's like dealing with all of them. It's just made my life so hard. And I guess while I'm telling you this, I'm not looking for people to feel bad for me. It's just, it's just the way it is, and it just kind of sucks when you have like a disability like that. But it's just like not something tangible. It's not something that people can just see and be like, okay, he looks normal, but he's not. Like it's not like I'm in a wheelchair or something. And it just kind of sucks because I feel like people expect certain things out of me that I just can't do. That's why it's just been very hard I've had to quit my job, and it's been very hard to find any type of work because it's really hard to explain, like what's going on. And I don't want to tell people that I have these vision issues because I'm afraid then, I won't get hired or whatever. But it really affects my ability to do a lot of jobs, and it just sucks. So I'd like to kind of talk a little bit about my experiences with doctors and trying to find any type of treatments or solutions to these issues. So first place I went, obviously, was back to where I got the surgery done. And when I went there, it was basically when I had just started to experience some of the visual distortions. So my vision wasn't horrible then, but it was starting to get bad, and I was starting to get, become concerned. So I went back there, and they had diagnosed me as having corneal erosion, which I did not have, and later went to like a real eye doctor, and they said I had no corneal erosion. So obviously they were just looking to find something they could diagnose me with, and basically just said, oh, we'll take these drops, this ointment, and you'll be fine in a few weeks. And obviously the issues never went away, and I went back there and they were very dismissive again, which I expected. I mean, the last thing they want to do is see patients that have problems after this. From what I've been told from a lot of other people that have had issues and have gone back to their surgeons, they dismiss you and they say you're crazy. This doesn't happen. It's all in your head. And they just really kind of demoralize you, and they don't want to hear about it. And it's sad. It's just really wrong. I mean, I always thought like a doctor was somebody that was supposed to help people, help their patients. I don't consider any of these surgeons doctors because they do not care about their patients' well-being. They're like used car salesmen to me. They're just trying to sell you a product, and they know it's dangerous. They know it could potentially ruin your life, but they don't care. Money is more important to them, and it's just really sick. And I think it's criminal, like what they do, and unfortunately they can't be held accountable. There's no way. I mean, the industry is so strong. I mean, I really didn't even want to look into legal action, but A buddy of mine had heard about my story and reached out to me, and he's a personal injury attorney, and said, we think you have a case because you weren't sufficiently warned. You had all these things going on. You had the huge pupils, this and that made you, a horrible candidate, and you weren't warned about it, and they should not have done the surgery on you. So we had looked into, different avenues, and basically really didn't have a case. The only way I would have had a case is if a so-called professional in the field would testify on my behalf. And what they consider a professional is, somebody that does these procedures, and there is no doctor that does these procedures that would ever want to testify against another doctor, because they would not want to deal with the backlash that they would get. And plus, then they'd also have to admit that these surgeries are actually dangerous and they would just hurt their business. And it sucks because even if another doctor had thought that, the surgery shouldn't have been performed on me, they wouldn't say anything. So it just really sucks when you can't hold these people accountable for the damage they do. It would have been nice to get a little bit of money out of it or some type of compensation, because it's affected my ability to work. I've spent probably about 10 times as much on other doctor's visits, on these scleral lenses, on all the drugs, the medications, the drops, all the traveling I've had to do all over the country, everything. Like I said, I probably spent 10 times as much on that than I did on the actual surgery. And they market the surgery. One of their selling points is, you won't have to spend money on contacts and glasses anymore after the surgery, so you'll be saving money in the long run. I've spent tens of thousands of dollars since then trying to find some solution. It would have been nice to maybe get a little bit of that money back, but unfortunately that's not going to happen, because you can't hold these people accountable, and it just sucks. So basically, after going to the LASIK surgeon, or who did my procedure, I'd been trying to find anybody who could help me. So I've gone to multiple corneal specialists and people that perform these surgeries, and nobody has really been able to help me at all. It's like they don't know what to do if the surgery is not successful, which I think is crazy, honestly. You would think that they would have, with all the schooling and the knowledge, and I've gone to supposedly some of the best doctors too, and they're just flabbergasted. They're like, oh, well, we have no idea how to help you. And it sucks. Getting additional surgery is definitely not something that I would do, and I'm probably not a candidate for anyway, because my corneas by this time are so thin that there's really nothing else they could do. There's no more of it to take off. And plus, I've heard that a lot of people that get these additional surgeries end up even worse than they were before, so I'm definitely not going down the surgery road again. The only thing that has helped are scleral lenses, which are basically giant hard contact lenses that you fill with a saline solution and you put in your eye, and it's basically supposed to act as an artificial cornea and kind of smooth out a lot of the imperfections that the laser surgery basically had damaged, because they cause all these they call them higher order aberrations, which are what directly lead to a lot of these visual complications. And the scleral lenses are basically supposed to kind of cancel out all of those higher order aberrations, and they do a tiny bit, very, very minimally. My vision's gotten so bad that I do notice a difference with the scleral lenses in, but they don't really help that much, unfortunately. And there's all types of lenses, and the ones I have right now are from Boston Sight, which are supposedly some of the best lenses in the world. And they only help somewhat. So it sucks because these lenses are so much more expensive than regular contact lenses. Each lens is $5,000 a piece, so they're not cheap, and they're such a pain to put in and to take out. You have to use all these special tools and plungers and things and solutions and chemicals to clean with. I mean, it makes putting in like regular soft contact lenses look like nothing. And it's just all the equipment you need with it too. It's just like, God, it's like I wanted the surgery to not wear contacts, and now the contacts I have to wear are like 100 times more complicated and cumbersome than my old lenses. I'm just, I'm like beyond words right now. Just to, describe the frustration and everything that this has caused me. So, I guess I'll just wrap up the video right now. I don't want to be too long-winded. I guess, what I can say is just, if you are considering a refractive eye surgery, just put a lot of thought into it. I mean, they say every surgery has its risk, and that's true, but this is not a surgery that anybody really needs. Anybody can wear glasses and contacts. God, I mean, I wish every day that I could just put on a pair of glasses right now and, have normal vision again. Granted, yeah, glasses and contacts are annoying, and I get it. They're a hassle, but they're nowhere near the hassle of, having to deal with all these issues and getting special lenses and this and that. It's totally not worth it. And some people a lot of people have great results, and I'm very happy for those people. And it's just you're rolling the dice. I mean, it's really not as safe as they say. It's not 1% or less are going to have complications. That number is really a lot higher. It's just the industry is great at making up stats and basically hiding information, and it's just it's a shame. So I feel like if there's any silver lining out of this whole experience, it's that I can educate people, I can warn people about the potential dangers of these surgeries, and I have talked to a lot of people out of these surgeries who were considering it. So I feel like right there, I mean, that's something great. That's a win in my book. In my opinion, it's just totally not worth it. And even if you don't have issues right away, 10, 15, 20 years down the line, issues could develop. It's just a matter of time before you will have issues. It may not be, right away. It may not be a year from now, 5, even 10 years, but eventually issues will pop up. So it's just really, it's not safe, and it's just not something I'd recommend, but people are going to do what they want to do, and it's ultimately your decision. But I just hope this video could just help educate and, inform people about the risks and maybe make you think twice before getting it. So that's all I have to say, and thanks for watching the video, and I hope you guys have a great day.